Hello doctors, this is Dr. Hira Salman. So welcome to MCQ of the day. So MCQ says a healthy 40-year-old man presents with a tuberculosis screen. He is asymptomatic with a normal chest x-ray and his last PPD 5 years ago was negative. Today his PPD is positive. What is the treatment? So he is 40 years old. He's coming for the screening of tuberculosis. Right now he is asymptomatic. Chest x-ray is already done, which shows normal chest x-ray. Last PPD 5 years ago was negative, but this time PPD is positive. So PPD is positive, but chest x-ray is normal and the patient is asymptomatic. It means your patient is having latent tuberculosis. For that case, what should be your protocol? So it's very obvious that those patients who are having latent tuberculosis. So first see in this MTB step 2 CK, it's mentioned after active tuberculosis has been excluded, and how we did that by doing chest x-ray. And here in this our patient chest x-ray is normal. So patient should receive 9 months of isoniazid. So here MTB is saying that we have to give 9 months of isoniazid, right? And here also you can see the shortest duration of therapy for a positive PPD is a combination of isoniazid and rifapentine for 12 weeks. So rifapentine here is for 12 weeks in combination with isoniazid. 12 weeks means 4 months. But if you can see in your question, it's written rifampicin. There is a difference between rifampicin and rifapentine, right? So this is not the correct one. Now, if you can see in MTB step 3, the same thing, but I just wanted to show you this CDC guidelines, that's the Center of Disease Control and Prevention. Here you can clearly see that there are 2 options for treatment with INH. First is 9-month regime and second one is 6-month regime. If an INH regime is used, the 9-month regime is preferred, but we can also go for 6 months. So there are options we can use for isoniazid. Here is mentioned, see, rifapentine. Rifapentine and rifampicin are different drugs. Different drugs having similar sort of actions, like half-life is different, enzymatic reactions are different. So INH and rifapentine. So here you cannot choose this option, okay, because here it's mentioned rifampicin. Yes. So the first thing is what? Second thing, either you can only use rifampin for 4 months, or you can only use isoniazid for 9 months and 6 months. So 9 months and 6 months, both options we have. And here I can also read this passage for you. It's very important that treatment of latent TB infection for 6 months rather than 9 months may be more cost effective and result in greater adherence by patients. Therefore, healthcare providers may prefer to implement the 6-month regime rather than 9 months regime. So 6 months is preferable on the basis of cost effectiveness. Every effort should be made to ensure the patients adhere to latent TB treatment for at least 6 months. For at least 6 months. And 6-month regime is not recommended for people with, of course, those who are having HIV or AIDS, or those who are having positive findings in chest x-ray. You will never give this one. The protocol is totally different for those patients. So here your answer is isoniazid for 6 months. Thank you.